Hey there, we are talking about neuroinflammation, microglia, things I hadn't even thought a lot about until this week. And I'm excited to chat about these with you today. So we're going to dive in. I was just recently this week speaking at the Western Neurotrauma conference at UCLA, and there was a whole session on neuroinflammation. So I got to share what I learned. If we haven't met, my name is Julie Hirschberg. I am a neurologic physical therapist. I am the owner and founder of Re+active Therapy and Wellness in the Los Angeles area here, and run an integrated neurorehabilitation program for people with neurologic disorders. And as part of this, I got invited by the UCLA team to talk at this neurotrauma conference, which is very cool, by the way. I definitely want to go again because I learned so much. And I just wanted to give you a visual here. It's totally tiny, but this was the agenda for the neurotrauma conference. And I got to speak, I'm going to pull this up so I can see it a little bigger, hopefully. I got to speak on the first day of the conference, and they had a section on rehabilitation. And let me just pull this up here. So that I could give you the names of the folks that really inspired this. Oh, shoot, maybe I don't have this picture up big enough for me. So there were three folks in this neuroinflammation section, all basic scientists, meaning they are doing some of the groundbreaking research with mice, which, bless their heart, these mice, it's very, very hard for me to watch some of the images of mice and brain injury and all of those things. But there were three folks, one from UCLA, one from UC Irvine, and one from Ohio State, all sharing some of the great research that they are doing on the role of neuroinflammation in three different areas. So they shared there was one, actually, let me show you a slide here from him. This is a slide. His name is John, and that's his lab. They looked at microglia priming and dysfunction after a traumatic brain injury. And again, this was just in mice, so not human models, but he really shared some of the interesting effects that occur down the line chronically after a brain injury in terms of neuroinflammation. Almost that these microglia are primed and dysfunctional. That's kind of what you can see on the side. Now, I also am not a basic science researcher, so bear with me. Some of these talks were like, I was taking notes, I was looking things up because felt like I was going back to like microbiology. I had a talk with John as well, and he's like, I'm a biochemist. And I was like, I'm a physical therapist. Let's talk. I was like, let's talk, because I told him, I said, I know you're doing this in mice, but let's talk about humans, and let's talk about what we can do about this too, right? So anyway, it was a really great conversation. And this really sparked my interest to read a little bit more. So of course, let me stop sharing here for a moment. I had to dive into the literature. Now, I will tell you, I've read probably like 30 articles because I was like, I don't know a lot in this area. So I'm going to have a hefty list in our newsletter this week. For those of you that don't know, I do a newsletter every single week, one sent out to clinicians, one sent out to patients. And I'll send you it with links to all of these articles. But let's talk about this idea of neuroinflammation first. I think neuroinflammation is kind of a buzzword. It's out there in the media. It's out in the literature. It is a part of many diseases. So once I went into the literature, and I knew this, I teach neuropathology at USC. We talk about neuroinflammation, particularly as a cascade of events in stroke, in multiple sclerosis, in spinal cord injury, and Parkinson's, and many neurologic diseases. At the conference, they talked about it in long COVID, they talked about it in brain injury, and talked about it in pain. And what was so interesting, it was the same thing. It was the same thing occurring with microglia. So I wanted to share, let me show you the citation here, and then I'll show you a picture. So I wanted to share resources. I'm just gonna fix this to make sure we're upright with you all if you wanted to also dive in deeper. So again, I'll put all of the links. Many of these are free full text articles. This was one looking at microglia, the autonomic nervous system. You know, that's one of my favorites. Immunity and hypertension. Is there a link? And turns out there is a link. This was more of a review article. But what I loved is that they talked a lot about what these are. So here's a little picture of the microglia. So if this is new to you, microglia is glial cells are some of the support cells in the nervous system in the brain. And microglia are little bitty support cells. They're micro-sized glial cells in the brain. And they really act as the immune cells in the brain, like a macrophage that you might see in the body. So they are activated in many kinds of responses. They're activated in response to stress. They're activated in response to a surgery. They're activated in response to inflammation or a virus. So they can get activated through many means. Sleep deprivation, by the way, is a huge way to activate neuroinflammation. So the microglia get recruited. That's what you see here. You see this is a blood vessel on the left, and then we're just going to call this like brain tissue on the right. So they get activated by a response in the blood, and then they show, by the way, you see all of these little factors that can influence what is happening in the microglia. What we can see on the right-hand side is the homeostatic microglia and the disease-associated microglia. So this is kind of where the microglia go in response to prolonged states of stress, of neurologic disease. What you saw in that last figure that I showed from Ohio State and his lab in chronic inflammation. So what we see here is that microglia are actually really good. They help with neuroplasticity. They do pruning for us, which we need. They help with neurogenesis. They help with rewiring things. So we need microglia. In fact, just like in our bodies, we need inflammation as well. Neuroinflammation is not an entirely bad thing. We don't want to wipe it out because it actually helps fight things that are really helpful for us to be fighting. We just don't want it overdone. Overdone seems to be the problematic piece. So those are the microglia. And we know, and I want to share, so I'm going to share, I know this is a lot of articles today. I wanted to share this article here. Oh, I hope I got the right one. Oh, this was one article, the benefits of neuroinflammation. I know I just shared that, but the benefits of neuroinflammation meaning we don't want to just wipe out neuroinflammation altogether. This is why, by the way, pharmaceutical management of this is really tricky. We don't want to just wipe this all out altogether. We need our microglia. We need some inflammatory response in response to an inflammatory event. We just don't need it overdone. So I just wanted to share that article because I think sometimes it's like you want it or you don't, and it's actually like a little bit is really helpful. So I wanted to share this particular piece here. So this was from another article that looked at, let me give you the name of the article, Healthy Lifestyles and Well-Being Reduce Neuroinflammation and Can Prevent Disorders. So, by the way, a ton of this research is going on in Alzheimer's disease because people really want to know, can we prevent it from occurring? And so lifestyle interventions are a really big component of that. But as a part of this paper, they included this particular image, which I thought was really helpful, looking at all the ways neuroinflammation may happen in the brain. So you can have damaged neurons that cause neuroinflammation. This is what we see post-stroke, MS, spinal cord injury, and so on. And then you see all of the factors associated with that. And then on the other side, so at the top is brain, at the bottom is the periphery. At the other side, we can see stress, trauma, infections, pathology also activate the microglial cells, which, by the way, activate other cells like the astrocytes, and release a lot of these other inflammatory factors that you can see there, TNF, some of the interleukins, and so on. You don't have to know all those names. I don't know all those names, but they're inflammatory factors. We can also see, so those are the two things happening within the brain tissue. And then we have these other things from the periphery. So coming from a lymph node, right? So from an infection, from immunity, autoimmunity as well. Those things can also cascade and cause some of the neuroinflammation. Now, I didn't want this, of course, to just be talking about all the bad things that can happen in the brain. When we talk about this, when they were talking about this at the conference this week, innately I'm going, well, that's really interesting and that makes sense. And that occurs in a lot of other neurologic disorders, this neuroinflammatory response. But what are we going to do about it, right? Like, I want to know, what are we going to do? And at this point, there have been, in animal models, they've looked at different ways and are looking for different ways that they may act on a cellular level with medications and so on to influence this inflammation. There are things that have been helpful in mice. So they were talking about how they can actually stop this microglia proliferation with aminocycline, which is an antibiotic. And then as I was looking through the literature, that has actually not been super helpful in humans. Well, one, we're not mice, right? But thankful for the mice for helping us understand some of these things, but not always what's helpful in mice is helpful in humans. So we have a long way to go when it comes to a cellular target for neuroinflammation. We don't have a super long way to go to know what lifestyle things could be helpful. So that's really, if we're going to talk about neuroinflammation and we're going to talk about the role in chronic disease, we then want to know, well, can we impact it in other ways, right? And so there is, and I just want to acknowledge, thank you for comments, questions, please bring them my way. One person is sharing, I'm overcoming a TBI and post-concussion syndrome. Thanks so much for sharing this. That is why I was at this conference, by the way. I got to talk about rehabilitation post-concussion. And with this idea that neuroinflammation or chronic neuroinflammation might be part of what is sustaining some of the problems post-concussion, the memory problems, the dizziness potentially, like any neurologic symptom, essentially the autonomic dysfunction. I personally want to know, well, how can we in rehab affect this? So this particular article This was from the first author is Muscat, the second is Barrientos, both from Ohio State, by the way. And this was called, it was in 2020, Experimental Gerontology, Lifestyle Modifications with Anti-Neuroinflammatory Benefits in the Aging Population. So I was like, yes, please, lifestyle all the way. And so this particular image, let me just pull it up because it's tiny on my screen. I know it's tiny on your screen as well, but I'm pulling it up here in this article. So this was figure 1 from their article. On the left-hand side, they talk about the effect of aging, of kind of priming the microglia for potentially an exaggerated neuroinflammatory response. And this is what is so interesting, because we have seen this as clinicians over and over again, and I've heard theories, but I didn't fully understand it. But they particularly talked about a person having more symptoms after, get this, after surgery. And I have had patients with Parkinson's, for example, where they didn't seem to have symptoms, and then boom, after surgery, all of a sudden they have Parkinson's. That is not how Parkinson's works, right? It is a long-term neurodegenerative disease. It doesn't happen overnight. However, it has been shown that people that go in for surgery in this primed microglia state, so they had Parkinson's before the surgery, but it was like subclinical. Maybe they weren't noticing or seeing symptoms. They go into surgery, which activates the microglia and gets this exaggerated neuroinflammation. Now, on here, they're putting memory impairment, but I would put literally any neurologic symptom can get worse. Now, I'm not an anti-surgery person. Some folks need surgery, but we do know that it can increase neuroinflammation. So what we see in the aging brain, excuse me, is this primed microglia. What I like is we can also like go to the left. I feel like that's a little dance move, but that's reduced neuroinflammation and neuroprotection. That's what we want for our brains as we are aging. I mean, I wouldn't even say in the aging brain, in all of our brains, neuroprotection, please. I do want to save my brain. And I feel like many of life events, the sleep deprivation of having kids, just having kids in general, stress, and so on, none of those things are very neuroprotective. So I do want to really think of things that are neuroprotective. And so on the right-hand side, they talk about those things that might cause that primed microglia to have an exaggerated neuroinflammatory response. Surgery, an unhealthy diet, infection, stress, we would put it all in there. And then on the other side, things that can support us and give us neuroprotection. Dietary strategies, an enriched environment. I'm going to talk about the research with this, and exercise. So we're going to talk about all those things that can be neuroprotective, but I see some comments here. Ravens, I'm a neuropsych BS. Oh, hello, neuropsych BS candidate at UCF. Yes, University of Central Florida. Love to get more involved with events like this. Do you know any conferences occurring in Florida? I don't, but I will tell you, people from Florida were at our conference. It was one of the things I loved about this conference was it was interdisciplinary. Largely basic science researchers, but also clinicians. There was a great group of PT, OT, speech therapy from UC Davis, for example. The OTs from the brain sport group at UCLA were there. I love being a part of an interdisciplinary conference, but anytime I hear about things, I will share them. So let's stay in touch. And then I saw another folks, berry juice 44. That's very interesting. My FND symptoms got significantly worse directly after my tonsil surgery. Yes. So we see this CRPS, for example, post-surgery. We see it with FND. We see it with Parkinson's. We see it with MS. We see it post-stroke. And some surgeries are necessary. So again, I'm not saying don't do surgery. You just might need some extra neuroprotection. You might need some extra rehab afterwards. And so you could kind of go in, I don't know, I would say like we could go in prepared, right? But also you might think twice about surgery. As a physical therapist, I'm totally biased, but a lot of folks don't actually need back surgery and do very well with physical therapy. So that I won't go off on that soapbox, but back to this study and what can we do? So they highlight 3 things that are neuroprotective: dietary strategies, exercise, and enriched environments. So I want to highlight some of that research. It starts in animals, and here's the cool thing with animals is you could do these things and then look at their brains, and you could look at the little microglia. You could put it under a microscope, and you're just not going to do that with a human. So you could get really down and detailed with the mice brain to see what is happening. That's just not going to happen in humans. So that's called preclinical evidence. What I like about this review is they talk about what is that preclinical evidence and what is some of the clinical evidence. So they start with the dietary strategies. And this is not surprising. I've heard this over and over again from neurologists and researchers. Mediterranean diet. Other diets that they have studied as well are vegan or vegetarian diets, very similar: high fruit, high vegetables, fish, low-fat dairy, not a super restrictive diet, but Mediterranean-like diets, lots of plants and veggies, can be neuroprotective. So most of the studies done in this realm have been in cognition. So again, we are trying to help prevent Alzheimer's disease. But some of the most recent studies found that plant-based diets or adding in more plant-based foods could improve cognition, like learning, memory, visual spatial orientation, executive function, and so on. Even if they are started really late in life. But the Mediterranean diet, again, comes up again and again and again. As the most helpful for your brain. And again, it's not a super restrictive diet. It's kind of like eat what you're normally eating, just eat lots of plants and veggies too. So that's great. There are some health diet related things we could do for neuroprotection that are not very restrictive. The second, though, is exercise. And of course, as a physical therapist, this is my favorite one. And we've actually been part of studies. So we've been part of studies in people with Parkinson's, for example, to look at the effect of exercise on learning and memory and cognition. And there is animal evidence to show that this has a neuroprotective effect. And there are loads of human studies to show that it has a neuroprotective effect. This was a really cool study that I hadn't read, where they looked at different groups of folks with long-term exercise. So this is a very long-term exercise study. And they looked at measures of neuroplasticity like BDNF, which is cool. And they compared, a dance exercise group or a strength and endurance exercise group. All of them did really well, but get this, the dancers had increased plasma BDNF concentration and greater gray matter volumes in the precentral gyrus and the parahippocampal regions compared to baseline. And this was not in the group that did a more traditional exercise. Now, this isn't saying everybody needs to do dancing. I think the best exercise is the one that you like. I particularly love dancing, but I also love lifting weights and I also love running. But one of the things that they talked about with this is that one of the benefits of dance, and like huge shout out to one of our personal trainers, I'm going to say shout out to Heidi. She's new with us. She's fantastic. She's a professional dancer and for many years has taught dancing through Parkinson's, which is a great group for dancing with people with Parkinson's. And I thought about her as I read this study because I was like, oh my gosh, we should have folks do more dancing. But these, they hypothesize that potentially combining physical activity with new learning might even be more neuroprotective. So that novel task, that novel focus could be helpful. Oh, yay. Oh my gosh, Berry Juice. I can't click on you to see your first name. It says dancing has been the favorite part of physical therapy with y'all. Yay. First of all, that you are with us. That is super exciting. And yeah, not everybody likes to dance. We don't do dancing with everybody. But if people do like to dance, yes, it's novel, it's new, and it's good for the brain. Other things that people have studied are even just what happens in the brain after an acute bout of exercise. And that looks to change some of the functional connectivity in the brain as well. One last thing. So we talked diet as neuroprotective. We talked exercise as neuroprotective. Environmental enrichment as neuroprotective. I really, really love this. This is usually defined as social and other stimulations. If you are a rat, that means you're in a social context and you have balance beams to play on and wheels and mazes and all kinds of fun stuff. And maybe if you're a human, you're also doing that kind of fun stuff. So you're in a social environment, you're challenged in different activities, and it's an enriched environment. And in my studies, this is an anti-neuroinflammatory. And I would say in a lot of the animal studies, this is like a drug to do these kinds of activities. Especially, I mean, there's a lot of interesting literature here in Parkinson's, for sure. But this is harder to study in adults, but they have found that this correlation, at least, of social network and environmental enrichment and a person's cognitive function. And so these they talk about things outside of just social. It could be activities such as playing games and puzzles and reading and cognitive stimulation. But much more work to be done for sure. But I think if we're going to talk about neuroinflammation, we're going to talk about these microglial cells gone rogue. Actually, one of our F&D members, by the way, Tim, he shared this with me today. I did a wellness evaluation with him. By the way, oh my gosh, he's doing so much better just in 6 months. He's walking, he's getting outside, his balance is better. And anyway, I could go on and on. But he shared this great article from BBC News on microglia gone rogue. And that was literally what this this part of the conference was about. It was like these microglia gone rogue, just excessively activated in a neuroinflammatory way. And if we know that's happening as we age. We know that's happening in neurologic disorders. We know that it's happening with chronic stress. We know it's happening in long COVID. We could basically, I would say, almost assume it's happening to all of us as we get older. I want to know what we can do, right? So it's one thing to kind of just be like, oh, well, it's just going to happen. Like, you know me, I'm not going to settle for that. I'm not going to settle for like, well, it's just going to happen. I'm going to want to know, what can we do about it? Because if this is happening and it's causing brain fog for people, causing connectivity issues in their nervous system, like we see with FND, causing severe fatigue, we should look at those pieces that can help. And it turns out there's many lifestyle components that can be anti-neuroinflammatory. So that gives me hope. That gives me hope. You know, we have a long COVID program. Many folks are really so debilitated by these symptoms. And I will tell you, by the way, we're not going to throw everybody into exercise when they have post-exertional malaise. So that's not what I'm talking about. But we do know that some of these other things could be really helpful for that neuroinflammation. We should do it. That means an integrated team, right? So if we know stress increases neuroinflammation, then yes, let's help to manage stress and work with psychologists. Let's work with OT. Let's work on that lifestyle piece. If we know that this is going to occur, Sammy's asking, can diet help? What the literature is showing is that diet could be helpful in neuroinflammation. And particularly, they talked about a Mediterranean diet, lots of fruits and vegetables, essentially. I want to say super simple. I know it's not easy to change your diet, but it's not a super restrictive diet, I would say. So if we know neuroinflammation is going to occur, here's where we can intervene. And there's no real side effects of lifestyle interventions, right? So it's not a drug that might have side effects, for which we don't have a lot of drugs that help with neuroinflammation. Yet that would be super helpful if somebody's neuroinflammation is just out of control. But we do have some lifestyle things. Lifestyle things are not easy to do. All of the lifestyle changes that I've had in my own life, I needed help to get there. It's not a matter of willpower. It's not a matter if you're motivated. Sometimes you just need help. And that help, particularly, for example, sleep. Oh my gosh, I read a dozen articles on sleep. Sleep deprivation causes neuroinflammation. And addressing and restoring sleep-wake cycles improves neuroinflammation. Well, guess what? OTs, psychologists, they do CBTI, cognitive behavioral therapy for insomnia, and to help people with sleep. They restore sleep so that we can undo some of the neuroinflammation. It's hard to do it on your own. It's really hard to just will yourself into better sleep. And that's why it's great to have a team to help you. So anyway, I could go on and on. As you can tell, I read so many articles. The sleep literature is so interesting. It directly impacts microglia, like directly. So to me, if you have disrupted sleep with any neurologic disorder or chronic disease, I would attack that first. I literally would, because it's going to set up your brain for changes. And if you need help, come see our OTs. But again, I'll put all of these resources in our newsletter. This is going to be a research-rich newsletter this week. Comes out on Fridays for clinicians, Mondays for patients. If you're not already on our newsletter, it's super popular. We have, by the way, like over 10,000 people on our newsletter. I think that's so cool. And I share what we're doing, what we're learning every single week. I will share this. If you're not on it, when I post the recording of this, comment newsletter and I'll send you the link. I just want to get back to questions, comments. When I get my degree, I'd love to start an F&D program for Central Florida. It is needed in Central Florida. We have so few providers, which is why I'm in neuropsych. I'm so thankful for you. I'm so thankful for so many people in our community who are here learning and curious and trying to grow to help folks with chronic conditions like FND. So I just want to say thank you. And I will be rooting you on for starting that program. Okay, and Sammy asks, can diet help this? Yes. And Melon says, I want to be on. So, by the way, if you are looking for more information on some of these lifestyle pieces that can be neuroprotective for you, we have loads of resources. So, we see people, obviously, in person at Re+active, in our programs. We see people online if they live in California or if they're living internationally. And we have these memberships. And so this is kind of what I'd recommend for you if you're looking to start in something. We have a membership for people with functional neurologic disorders, a membership for people with Parkinson's disease. It's all online, and we literally have tons of learning and training on sleep. We have it on these lifestyle factors so that you can start to learn about your own brain and body and gain control. So if you're in Texas, yes, you can join our membership. So just send me a message and I'll send you a link. By the way, we're actually working on getting a license in Texas. We have a PT who's licensed in Texas, but we're looking to get our whole team licensed in Texas so we could also help you online. But we're not quite there yet. But our membership is a really, really great way to start. It's why we started it, because people were reaching out and asking questions and wanting resources and wanting connection. By the way, our PT, OT, psychologists, we're all in the membership. We teach the classes. We have an online community. So we're in the community answering questions. It is awesome. Probably one of my absolute favorite things to be a part of. So yeah, it is, it's really like my favorite thing to do. Oh, and Lisa said, my daughter's 17. We live in Iowa and she's coming to California in November to be a part of your treatment program for FND. Oh my gosh. Thank you. Thank you. She says, so thankful for you guys. I have to tell you, I'm a mom of teens, and I absolutely would drive across the country for anything to help them. And I know it's a really big deal to do that. Like my hope actually with doing a lot of education and resources for people is that people don't have to do that. But oh my gosh, what the FND. Okay, by the way, that's the best name ever. What the FND. I love that. And you're the daughter. And I can't wait to meet you in November. Probably my favorite thing is just meeting you all when you get here. I get to be a part of the dance parties. I get to be a part of like your team meetings and groups and all of that. I'm thankful that you are putting your trust in us and that we get to be on the journey with you. There really is nothing more that I love that we are entrusted to just be with you. It just makes me so happy that we're going to be able to see you. And what the FND, get ready for actually a lot of fun. And it's going to change your brain and your body and your life. And so get ready for that. I'm excited really to see what is in store for you. Just quick story. We had a young married guy, so maybe not as young as you with the FND, come, and he came out with his wife. And I'm actually going to just pull this up because this is the kinds of things that we get to see. His wife said, I thought I was going to be a widow before I was 30, and now I have my best friend. and he is back, and it is his best self ever. And this is something I hear again and again from folks in our integrated program, is not only do they learn a lot and get they do rehab and they get better, they learn so much about themselves that they feel like a different person, like they can be their best self. Berry Juice is saying, I've been in the program for about 2 months and it seriously saved my life. I'm so glad that you're here. I'm so glad you're with our team. And that really means a lot to know. They shared, I never thought I could see this much improvement. We're going to not only meet your goals, but crush them to the next goals. Oh my gosh, thank you. And you're like already doing rehab with us and coming and learning about microglia and neuroinflammation. So many kudos to you for lots of learning. Seriously, thank you. I mean, I honestly, I feel so very grateful that that our team really get to be in it with you, in the dark places, in the high places, all of the places in between. So thank you. And thanks for coming tonight. And thanks for hanging out to talk about microglia and neuroinflammation. It certainly piqued my interest this week speaking at the Neurotrauma conference. And so thank you for learning and listening with me. And I hope you have a wonderful night. And what the F&D, can't wait to see you in November. Berry Juice, we're gonna have to meet up while you're here for sure. So I'm gonna check out your schedule and meet you in person. So thank you so much, everyone, and have a good night.